get admitted at a hospital, you're generally looking at getting treated and getting out of the hospital as soon as possible. But what if the hospital itself gave you an infection? Even worse, the infection could not be treated. Hospital-acquired infections are a dangerous trend that has doctors in India worried.
We may cure the patient of the illness he has come up with, but he may die of the problem he acquires in the hospital.
It could happen at any of these points: handling needles, gloves, saline, feed, or even procedures. Studies conducted across the country, from AIIMS in the capital to hospitals in Chandigarh and Goa, show that anywhere between 10 to 80% of ICU patients get hospital infections.
That's between a 1 in 10 and an almost certain chance. Now, roughly between a third and 60% of those bacteria are drug resistant, and many of them are highly drug resistant or multi-drug resistant, which means they don't respond to many antibiotics.
These infections are now being increasingly caused by superbugs like the MRSA and NDM1 that are resistant even to the most powerful antibiotics like the carbapenems. While safe medical practices inside an ICU are important, the real solution lies with you. Remember, every time you abuse an antibiotic, you give the bacteria a chance to grow stronger and resist it, creating a drug-resistant superbug in the first place. These in turn infect the patients in the ICUs.
We've only had antibiotics for the last 60 or 65 years. Prior to antibiotics, if you had a simple bacterial infection, you could pray, and if you were lucky, you lived, otherwise you died.
So do your bit and use antibiotics rationally. In New Delhi, Shalini.